meet. Namaskar.
Namaskar, Sandhya ji, namaskar.
Namaskar.
Thank you for sharing number of Aparnaji with Maria.
Thank you, Santhaji.
Namaskar, Sparnaji.
Namaskar.
Welcome.
Uh, we have our very commendable chairperson, Yona Kovici. She the chairperson of ISIS Delhi. She has just joined, and I'm just rather waiting for her to introduce to all of you. Bhagwanta ji, thank you for joining. Anuj bhai, thank you for joining. Alright, we have just another minute to go and we'll start live streaming. Yota ji, namaskar. Thank you so much for joining.
It's nice to be back after a couple of weeks. We got busy with training for the TIS Arogya Mitras. So now we come back to our own.
Fantastic. I mean, seeing you here is always so much inspiring, and I'm always enjoying your splendid presence. During each webinar. So, friends, she's Yosa Govilji. She's the chairperson of Indian Cancer Society, and Jyotadeep says Aparnaji, then we have Raji Kapoor, and Radhika says from Bangalore says a caregiver. So today we have two survivors and one caregiver, to share their experiences and journey. So let's start the session. Officially, it's going to be live streaming. So good evening, friends. I'm Shrenik from Ahmedabad, and I'm super fortunate and blessed, and I'm rather short of words to express my gratitude to Indian Cancer Society for giving me this splendid opportunity as a patient ambassador and moderator of live webinars. And if I'm not making mistake, today is our 35th live session we are doing. Another I'm moderating on behalf of Indian Cancer Society, Delhi. Now, today we have three speakers. One is Aparna Roy. She is from Delhi. She is cancer survivor, two times cancer survivor. Then we have Raji Kapoor. She is also from Delhi. She is cancer survivor and leg amputee. And then we have Radhika. She is from Bangalore and she is performing commendable duty as a caregiver. So let me start by introducing Aparnaji. I mean, she's from Delhi, as I said. She's cancer survivor, psychotherapist. She got her degree from Hong Kong, and she's doing a lot of charity work. And on top of that, planting trees and giving commendable, doing commendable activities even at this age. So, Apanaji, thank you so very much for joining us today. I wish you healthy years ahead and all the very best for the activities you are doing so far. And over to you, please feel free to share your journey. Over to you, Apanaji.
Thank you. Thank you. As Shrenik introduced, I'm Aparna Roy from Greater Kailash, Delhi. Same place as Sandhya stays. So I'm indeed thankful to Shrenik Dr. Priya and Sandhaji. Sandhaji is the director of Prashanti, an NGO in Delhi. I went there a few times to teach the kids, suffering from cancer, some yoga and some counseling. And I met there, and she introduced me to all of you. So besides psychotherapy and yoga, I have diploma in naturopathy, which helped me, and basic pranic healing. Every year, I plant at least 30 saplings of jamun, mango, etc. Today, I'll share my journey from January 2014, when I suffered from pancreatic cancer, till now, which will throw some light on surviving, fighting, and coping with cancer in a holistic manner, also removing some misconceptions about cancer. I suffered from pancreatic cancer in 2014 and uterine cancer in 2023. So I'm sharing my talk after consulting with my oncologist, doctors, some research papers and books. So today my paper is based on that. So what is health? In Sanskrit, there is a beautiful word, swast. Swast, swa is self and stha to be established in. That means whose consciousness is established in self. So what is cancer? According to me, it's a collection of abnormal cells called tumor. A uh, tumor can be cancerous or benign, that is non-cancerous. So cancer cells are characterized by genetic mutation, loss of normal function, and metastasis. That is spread of cancer via lymphatic and blood flow to distant organs, which we'll discuss now. Some knowledge about cancer can help us to cope with this dreadful disease. But most cancers are preventable if detected in early stage. So development of cancer occurs in 4 steps. Psychic stage, where symptoms are in mind level. So we have to be very careful about our mind. Psychosomatic, where mental symptoms percolate in the body. Somatic stage, physical symptoms overweigh mental symptoms, and you can feel in your physical body some of the pain and things of cancer. Organic stage, these are irreversible structural changes in the body, and cancer manifest. Causes of cancer. There is no single cause responsible for it. Many factors known as carcinogens contribute to cancer. It can be environmental, toxic environment, pollution, too much of sun rays, as I have seen abroad, people suffer from skin cancer. And there are biological factors. When immune system fails, body becomes weak, cancer appears, like undernutrition, which may be lack of vitamins, proteins, folic acid, zinc, etc. So emotional state of mind can contribute to cancer. In my case, it was stress, worry, fear, boredom, and sometimes discontentment. So other other reasons are anger, jealousy, too much cruelty. People suffer from that. Then, so wrong lifestyle and habits also are responsible for cancer. Carcinogens present in food. Well, I feel karmic account is also there, because when I um, feel about myself that I haven't done any cruelty or any jealousy to others, but why I am suffering. So it may be karmic. Carcinogens present in food, alcohol, fat. Nowadays, the news telling us not to have food fried in high temperature, like samosas, pakoras, French fries. And sugar, I feel, is one of the biggest culprit, because cancer cells, they feed on sugar. Too much of vitamin A can cause lung cancer. I found mouth cancer in my hospitals, when I go to hospital, due to tobacco intake and also pesticides in our food nowadays. We can become careful by physical symptoms, which I had, sudden weight loss, poor appetite, tiredness, pain in the body, irregular bowel movement, bleeding. In my case of uterine cancer, bleeding like, it started after menopause, after maybe 14, 15 years of menopause. So immediately you should consult a doctor if these things, you feel. So how we can prevent it? First is mindfulness. Connect to oneself, physical, emotional, and spiritual aspect. I'll now follow. Taking nutritious food is very important. Regular exercise, yoga, pranayam. Sleep is again, rest and sleep is very important, I feel. And I relaxed nowadays by music, art. There is dance also. First of all, positive attitude is very important, and forgiveness. Diet. Uh, Before operation, my doctor, oncologist told that though you are from good family, but you have low immunity and all. So because you may be not taking food properly, and I'll tell you, you should love yourself and love others. Love yourself, because I was teaching, the street children and all, and I never bothered to have breakfast on time. So that made me very weak. So I feel juice, homemade food, coconut water, dehydrated, especially every day and during cancer. Lemon is a great fighter of cancer. So my doctor during pancreatic cancer told me, ma'am, never leave lemon. Take 2, 3 times in a day. And now I share a very important thing, that is green shots. We naturopathists, we learned this. Green shots are like give us hemoglobin because we become anemic. I blend dhania or one day dhania, one day wheatgrass, one day curry patta with water and strain and drink. This gives you enough detoxification as well as energy. So yoga nidra is another thing which I think everybody should follow. And spiritual aspect, I'll say that we are Atma, we are not this body. Sometimes we are overwhelmed by the suffering. And so if you, I try to remember that I'm Atma and nothing can, which is eternal, and nothing can destroy me, that gave me some power and inner energy. So remember, we have unlimited potential, strength, and wisdom. So we have to make use of that to fight cancer. And be with Mother Nature, walk on soil, sit under large trees, and take the ground prana, air prana, and sun prana. My journey, I um, I feel that diagnosis of cancer for the patient and family is dreadful. In January 2014, I felt pain in the middle of my abdomen, um, and I went to the doctor. Especially it was when I was meditating. We are posted in Africa as my husband is an IFS, Indian Foreign Service officer. PET scan was done there, and the reports were sent to India. And through telemedicine, they told that it's abnormal cells in the tumor. So it was in the head of the pancreas. And generally, pancreatic cancer is detected much later in advanced stage. And in my case, it was detected in the first stage. So we came to India. A friend told us to consult Dr. Advani in Bombay, and he was wonderful. He advised to start chemo immediately, then surgery of pancreas to remove that tumor, and then chemo again. One doctor, uh, I'll tell you the name, that is Fortis. He told my husband that she won't survive more than 3 months because it is pancreatic cancer. So we must have some knowledge of cancer ourselves. to survive. So chemo started in 2014 February. We came in Jan there. Surgery was done in May 2014 by a famous surgeon, Dr. T.K. Chakrabarty at ILBS. So ILBS is the Institute of uh, Liver and Biliary Sciences in Basankunj. This is something really very good. So this gentleman was God sent. He did 9 hours of people's surgery. In December 2014, PET scan showed no trace of cancer. So my husband was ambassador at that time in African country. I I was so well mentally and physically that I went there, joined him, and helped him to organize Republic Day because as president gives reception here, we ambassadors give there. So faith in him and in myself gave me enough energy, and I organized first yoga day, met here uh, Modi ji and others. We came back again in May, and 21st June we had a huge successful yoga day. So then in 2016 I got diabetic. No doctors told me that don't take sugar, and I used to take little sugar as a Bengali, but very little. So insulin was given, and I was again very shocked that I had diabetes now. So after that, it became controllable. I have diabetes now. I started leading a very normal life and a positive life. After long 9 years, in 2023, cancer came back again. I had pain in the lower abdomen, and again during meditation and yoga, I felt that. My sixth sense told me that there is something wrong, and uh, my guru, naturopathy guru, told me that pain tells you that there is something wrong. So he advised me PET scan and then MRI because during PET scan, this is also very interesting that I reacted to IV medicine and the image was not clear, so I had to go for MRI. So then we are told to get the blood test done, that is CA 19.9, CEA, the parameters. These are cancer parameters. So they were very high. So doctor knew that there is cancer in the body. We met onco surgeon. She gave date and the surgery. Now the main thing was that I had to my husband to doctors. It was very stressful. Stress echo was done, and during stress echo, I was fainting because of the stress and maybe running around and not having food on time. So they tried robotics first, and they told that robotics will be wonderful. But in the operation theater, uh, it failed, and then they did open surgery. Doctors removed the uterus and the lymph nodes. Now, again, interesting case. Recently, my cousin died because her lymph nodes were not removed. She had again uterine cancer. So, metastasis, which moves this cancerous cells to the different part of body, and her body was full of cancer cells, and she died very young. So I felt better. They called me again and confided that it is a case of stage 3 cancer. The mice were very aggressive. They can spread anywhere. So advised chemo, radiation, and chemo. So in December 23, like after 1 month of surgery, chemo started. 27 radiations were given. It made me bedridden from bed to toilet, very little food, and was my daily routine. Side effects were many. So people who have suffered from cancer know that hair falling, chapped lips, anemia, fatigue, nausea. My teeth were very good, so they broke, and half of my hair was black, and that became completely white. So on 9th November, only few months back, 2024, I had chemo and I was unable to take that chemo. So I suffered edema, that is swelling in my leg. I think I showed to Sandhyaji once. So nausea, weight was 44 kg from 52. And from 12th November 2024, I started having rectal bleeding, heavy rectal bleeding. Instead of stool, it was only because the whole intestine, lining of the intestine was perforated. On 14th, when the room was full of blood and I fainted, my husband and friends and my sister took me to ICU and the ambulance was called. So immediately they gave blood and the gastroenterologist, Vivek Raj, he's got sent to me and his team started endoscopy and colonoscopy and tried to stop the bleeding, which was causing, I had poor hemoglobin, only 4. And that's why I was half unconscious. So I stayed in ICU for 15 days and 3 days in a private room. 24 units of blood and platelets were given because my immunity was very low. It was like a nightmare for me and my family. My husband was really devastated. So, in between, yeah, they before this, I want to mention that immunotherapy was given for 23 lakhs. I had 4 immunotherapy. So, uh, they should have known that my body, not everybody is fit for immunotherapy. And that had so many side effects that I became very, very weak. So my question at that moment was that is it blunder or a commercial ventures by some doctors? Because I told them that I cannot take any chemo. During that time, I just prayed and meditated, whenever I had the consciousness in the ICU. And so I did pranayam and meditation. So I had speech therapy because my voice was lost. God sent very good doctors at that time and nurses who saved me. So I conclude by adding that faith in higher power, you should have be aware of your inner power, be positive, forgive and love yourself and others. Bless and pray for everybody and Mother Earth. Thank you all for listening, giving your precious time. Thanks for giving me this opportunity, Shrenik ji and Dr. Priya and Santha. Thank you so much. Thank you.
Thank you, Amarnaji. First of all, let me congratulate you for your survivorship, your courage, confidence, and everything you just mentioned. This is, I must say that this is a real life journey, and this you cannot survive if you do not have enough courage. And you are so fortunate that you met commendable sometimes common is a reason, but it's all about survivorship. So thank you so very much for joining us today and sharing your, I mean, quite courageous journey. And we wish you all the very best and to continue your journey with planting and everything you are doing, and all the very best. Now, friends, over to
Thank
Raji Kapoor. Over to Raji Kapoor. Hello, Raji Kapoor. Thank you for joining. By the way, Raji Kapoor, she's I would say, she's multifaceted personality, two types, cancer survivor, leg amputee, and I again, she's from Delhi, and so she's doing commendable. I must admire everything you are doing, and I wish you all the very best. And the stage is all yours. Please share your journey, experiences, expertise with the attendees.
Namaste, Shrenik. Thank you very much. Thank you for giving me this opportunity and inviting me. And I also want to thank Indian Cancer Society for giving me this opportunity to share my journey. Uh, to start with, I have been on teaching profession, and I have been a mathematics teacher by profession, and I have taught in 12 different schools. And life was going great till the age of 32, when in 2012, I was diagnosed with a rare condition, rare cancer called as molar pregnancy. Now, molar pregnancy started when I actually conceived. I had one child at that time, and I conceived. And then, unfortunately, I was told by the doctors that the baby inside me is not growing properly and it has converted into malignancy. So, they call this term as molar pregnancy, and this is a very rare cancer which happens mostly in Western countries, but it happened to me. It was a very devastating moment for me because on one hand we were very joyful that we are going to complete our family, I'll have a second child, but it became a devastating moment when this diagnosis came, when this cancer was declared that I have cancer in my body, and the baby which was there in my body, that got converted into cancer. So after that I was told to take chemotherapy, and I took 6 cycles of chemotherapy. After that, in 2015, I was blessed with a baby girl, and then I had 2 children. So I was very happy in my life and I was doing well. That finally my dream of having 2 children got completed. But in 2016, I was diagnosed with another cancer. This was a rare cancer called a synovial sarcoma of right knee. So when this happened to me, again, it was a shocking moment for me and my entire family. And when cancer happens, it not only affects your body, it also affects your mind and your soul. So it affected me in many ways, mentally, emotionally, because again, on one hand, I was very happy that I have 2 lovely children to take care of my family. But again, this cancer came. So after surviving from the first cancer, the second cancer happened. And again, my diagnosis came, it came out as sarcoma. Now, sarcoma, I was unaware at that time what it is. So when I landed up in AIMS and I showed to a doctor, Dr. Samir Rastogi, he told that this sarcoma is a cancer. So we know a lot about other cancers like breast cancer, like lung cancer, but no one is aware about sarcoma. So even though I was from an educated background, even I was not aware what exactly is sarcoma. So these are very rare cancers. They happen to 1 in a million. And mine was very different. It was synovial sarcoma of the right knee. Finally, it was very devastating, but then we had decided to move on further and take treatment. So I was told to go for surgery. I and my family, my husband, my father-in-law, they took me to Tata Memorial, Mumbai, and I underwent limb salvage surgery from Dr. Ashish Gulia, and he performed a limb salvage surgery. Then I was told to go for chemotherapy. I underwent 5 cycles of chemotherapy. I lost all my hair. I lost all my eyebrows. I underwent a lot of side effects of chemotherapy. Then I underwent radiation. Again, there were 30 sittings of radiation. So this entire process of cancer was so time. I mean, it took one complete year to undergo the treatment of cancer. And as cancer patients, we do face a lot of social issues. Our confidence gets shattered. So same happened with me, because I felt that I'm not looking nice now. I started questioning my worth. It affected me mentally and emotionally in many ways. But after that, when the treatment happened, the treatment got over, things went well, and I was doing very well till 2023. So in 2023, I had an implant failure. The rod which was put in my leg in 2016 had got broken. And finally, after multiple surgeries done by doctors in a 20-day span of time, and each surgery was of duration around 12 to 15 hours. So they had to decide to do my amputation. Now, this was a very tough call for the doctors, even for me, because losing a limb is just not easy. For other people, amputation may just be like that one is losing a limb, but actually, one does not just lose a limb. Like, it affected me to such a way that I lost my balance, I lost my mental balance, I became depressed. I started taking antidepressant pills. I lost my confidence. I was not feeling worthy of living. I had suicidal thoughts at that time. I thought, why should I be living and burden on my family? And then I faced many body image issues. And there were people at that time who were judging me because they felt that I am incapable of doing many things. They thought that I can't do things because I'm an amputee. Now, they were not looking at me that I am capable. My brain is active and I am capable enough to do many things. So this shattered me more at that particular time. But then I decided that I will convert this pain, this adversity into a purpose of my life. So in 2016, when my cancer treatment got over for synovial sarcoma, I then thought that if I would survive, I would dedicate this life to do something for other people. And I wanted to create a sarcoma support group, because the help that I did not receive in my time, I wanted to create a platform for other people. So then I met Dr. Rastogi, and with the help of other sarcoma patients, caregivers, and survivors, we formed this support group, Sachin Sarcoma Society. So this is a dedicated sarcoma support group in India, where we have patients. We have so far been able to help around 9,000 patients. We have been working from 2018. We have made an impact on so many patients, international patients and patients in India. And our mission is to spread awareness about sarcoma and build companionship with their affected families. We want to instill this kind of feeling in every patient that no sarcoma patient should live alone. We are all there to support them in the best possible way. So when all these things happened, and in 2023 amputation happened, so again I went into depression. I took antidepressant pills, and I started questioning my worth. I lost my confidence, lost my balance. I was dependent on many things, on my family members, which was not a happy feeling, because the worst feeling in the world is when you are dependent on others. No one wants to be dependent on other people. So I was not feeling happy about it. But then I decided that now, if this has happened, I have to do something for other people. If God has given me this life, it is to do something good for other people. So during my treatment, what I want to share certain things that I have been doing right from 2016 till now. I'm a very spiritual person by nature. So I had a lot of faith in God, and I always feel that my faith in God is stronger than my fears. Second thing is that my family support has been immense. My husband, my children, my father-in-law, my Mossy, and with the blessings of my parents, I am able to survive, and I am able to do whatever I am doing. The third is the purpose. The purpose in my life is to do something good for other people. So this keeps me going. This keeps me motivated to do more good for other people, because I feel that if God has given this life, it is to do something good for the other people. So the thing is that now at this age, at today, I'm the president of Sachin Sarcoma Society. I go to AIMS Hospital on every Monday and Thursday in the OPD. I meet sarcoma patients. I talk to them. I listen with empathy. I understand their concerns. I emotionally counsel them. We, as Sarcoma Support Group of Sachin Sarcoma Society, we distribute information sheets. We do provide them financial support, administrative support, logistical support, and try to support them in whatever way we can. So, apart from all this community service work, I'm also very passionate for writing. I have undergone a lot of mental health issues during my treatment. So I understand that sometimes people look well, they are dressed well, they appear to be physically fine, but mentally they go through a lot. So I love to write and I love to speak on issues related to mental health matters. And my passion is that if I can do something, if I can emotionally counsel someone, if I can bring smile to someone's face, it gives me a lot of satisfaction and happiness in my life. So keeping this in mind, I've also started my YouTube channel, motivational channel, where I try to make videos which are relevant from the cancer patient's perspective, because after remaining a patient and going through this journey, it has just not been easy. So I feel that whatever experiences I have, whatever reflections I have, whatever has helped me during my time, if I can, share my knowledge, share my experiences with other people, it would help them in the best possible way. My final message to all the patients, please stay strong. Please do not give up. Things do look overwhelming. There are times in our life which are very unpredictable and we are not happy with the situation. But we need to keep reminding ourselves that this is a tough time and tough time will pass. It will pass in its own time. We have to keep reminding ourselves that better days are coming. So even when I was bedridden, when I was, underwent amputation, I kept on speaking to myself that one day I would be able to go to washroom. One day I would be able to go to kitchen and cook food for my children. One day I would be able to go to attend my children's PTM. One day I would be able to, climb up the stairs and do everything possible, whatever I can. So, sometimes we have to be very mindful about the words we speak. Whatever we speak if we speak with good heart, with good intention, it starts manifesting. So this is very important that we should keep doing affirmations and we should visualize the life that we want. If we keep thinking and keep saying that my life is not good, my life has got over, then whatever we will say, it will get manifested. So we need to be very mindful of what we are speaking, because what we will speak, it will become the reality of our life. I also want to give a message to all the caregivers. Please, cancer is just not easy. It is very difficult. It takes a toll on everyone's mind, whether physically, emotionally, financially. A patient cannot survive unless and until he has good support from the caregiver. But sometimes when I go to OPDs, I meet many caregivers. I see that caregivers are more anxious as compared to their respective patients. They're more depressed or they have a lot of stress, anxiety, because they are the ones who do a lot of running around. So my advice to them is, please take good care of yourself. Unless and until you take good care of yourself, you cannot do something good for your patient. The patient cannot survive or cannot bounce back if he does not have your support. So to support him, it is important for you to take good care of yourself. And my last message that I want to give to everyone is that life is very unpredictable. Unfortunate things happen. It is not in anyone's control. Challenges do come and difficulties come in our life. That is not in our control. But what is in our way is, instead of thinking why this has happened to me, why I am the chosen one, have I done some bad deeds, instead of thinking why me all the time, it is important to accept the situation, that whatever has happened, and now we need to think how to move forward, what to do next. So after undergoing amputation, every day, it's been 3 years now. After the amputation, I was walking with a walker. It took me time to start walking like a baby again, try to relearn how to walk again, just like a baby learns. And then I started walking with a stick. Now it's been 3 years, and after 3 years, I have started walking without any stick or without any walker. So every day in the morning when I sit for yoga, I do affirmations for 5 minutes. I do meditation and I thank God for this life. I feel that it's a blessing that I'm alive. I don't ask for anything. I just say thank you for this particular life. And till the time I'm alive, I should do something good for the other people. I truly believe that service to humanity is service to God. And instead of thinking that I've lost one limb, which has already gone, it cannot come back now. I feel grateful that I have two hands, I have two eyes, I have my two lungs, I have two kidneys, I have one leg which is functioning well. So the point to emphasize is that instead of thinking what is not there in our life, which is not what is not in our control in our life, it is important to think what things we do have. It's important to be grateful for what you have. It's important to develop the attitude of gratitude. And once we develop this kind of mindset, I think we can try to overcome any kind of adversity. Thank you very much for your kind and patient hearing.
Thank you. And Rajvi, I must compliment you. I mean, I have never come across someone like you so far. I mean, for last 25 years. And let me admit, I don't know whether somebody has told you or not, but let me tell you that you have re-engineered, yes, you have re-engineered your life and you have climbed the evidence of your life, you know, despite being amputee, despite being two-time cancer survivors, and I salute your dedication, contribution, your courage, confidence, and yes, spirituality is the ultimate thing which is in our control to make things happen. And I must admit that we have done fantastic, fascinating things in your life, and all the very best, and continue everything you are doing with the full of energy and enthusiasm, and all the very best. Before I proceed to Radhika, if anybody would like to ask any question, and Jyotaji, if you would like to share your experience, your thoughts, or if you want to ask any questions, kindly proceed.
I would like to congratulate Rashi. We've met before, Rashi.
Yes.
I saw you come on our stage with a walker.
Yes.
The next year, I saw you come with a stick.
Yes.
And I know the amazing work that you do.
Yes.
So I'm very happy that you have come on this platform to give everybody a glimpse of what courage means and what positivity can do. So
Yes.
God bless you. I know that you will be going places.
If I can be of any help in future for Indian Cancer Society, please do let me know. It's always a pleasure to come and attend all the annual seminars of Indian Cancer Society. I think last time Indian Cancer Society had given us award for the best NGO award. I still remember, and I'm so grateful. And your team is doing commendable work. In fact, Shrenik himself is so inspiring. It's hats off to everyone's courage. It just takes a toll, but I mean, hats off to everyone. We all learn from each other. So thank you for giving me this opportunity.
Shrenik Bhai, I also want to thank Aparna.
Yes.
Because she has had an amazing journey also. And she's managed to navigate that with courage and to survive pancreatic cancer is not a joke. I can quite understand, Aparnaji, that people will have told you that there was no life after pancreatic cancer. I'm one of those people who believes that there is life after every cancer. And it is what we make of it. And I think what you are doing is wonderful. I just want to make one little suggestion to you, correction. Prashanti is a part of the Indian Cancer Society. It is part
Yes.
of the circle of what we do, which is
Yes.
from awareness to screening to medical assistance to emotional support, and then to healing. And that is where you have been going. And I thank you for your contribution to Prashanti. So, to both these lovely ladies, many, many thanks.
Thank you so much
Thank you so much.
And Shrenik, this is
for
our,
connecting me with
this
all of
is
you.
our
Thank you.
third thing. I'm
Thank you.
rushing a little bit, please, ladies, because I have to go into another meeting. I am late, but I told them I would not come until I had said my thanks to you all. So, Radhika,
Thank you.
where are you? Are you there?
Hello. Yes, I'm
Yes.
here.
Radhika, you're one of our therapists, I understand.
It's very inspiring after listening to Rashi ma'am and Aparna ma'am's, what they have gone through and how they have come out strong, and everyone knows about Shrenik sir. So I'll just start about my story. So I am currently doing working as a software engineer. So my father
Radhika,
was
I'm
diagnosed.
sorry, I'm going to cut into your thing. I need to leave just now, but
Yes.
I'll make sure I catch you on YouTube.
Sure, ma'am. Thank you.
Okay? Thank you so much.
Thank you.
Bye, ma'am.
Thanks, Shrenik. Lovely to be with you.
Thank you.
So in 2018, my father was diagnosed with fourth stage vocal cord cancer. So we are a family of four, and we are two daughters, and my father is the one, holding us like a root. So anything happens, any stress, even for the small things, our father will be always talking and keeping us going, right? That kind of a person he is, and he loves to talk. So suddenly, since from the previously like 6 months, his voice started becoming low and he couldn't speak. So many different symptoms we were seeing, but we were not sure what it was because of. At one point, he was not able to completely sleep. In the sleep, he was getting some, sometimes the breath stops, some kind of um, discomforts. So we didn't want to take risk. We went to doctor, and we didn't know to whom we have to see. So we went to a general physician, and everything happened. And finally, they said it's a fourth stage vocal cord cancer, and we are like all shattered. So then in one particular hospital, they said it's waste. Even doing surgery, nothing is going to happen. He will not. He'll stay for 1 year more, or like that. So we being two daughters who's always dependent on the father, and my mother is also very innocent. So it was very, very big shock, for a big earthquake for the whole family. And we are like these days nuclear family. We don't have much of relatives to support or anything. And then they said, okay, then we came to another hospital. They said we have to remove the whole larynx. We don't know what it is. So then we went through that, and in hospital also, the helpers, right, none of them are much aware about how to handle this kind of patient. So they have removed it, and they made some here some cut, and they made one stitch here to here, because he should not move his head. So none of those people who take him in the stretcher, put him in the bed, none of them were aware about it. They were randomly throwing him in the bed. Even the hospital is a very big hospital. We managed to make the surgery in a big hospital. So these kind of things are not happening. Suddenly, the next day onwards, my father is not talking. So his only conversation with us and our father is only with the eye. Even though he do some mouth, he do something, he talk, we try to lip read and we try to identify. And that is when I learned about Shrenik sir, and he was the one actually guiding us what next can be done, whether he'll be able to converse, whether he can we hear him. So there was some suggestions about a voice prosthesis which they inject in the esophagus, right sir? So that one was suggested from the hospital, and they will puncture the esophagus and they'll put. And I was not sure whether to go through that, because immediately after the whole surgery, some 30 cycles or some number of radiotherapy he have gone through. And that it was not painful at the moment, but on going forward, it completely, he got so much of wound near the stoma. We didn't know how to handle all of that. That is when sir told this electrolarynx will be helpful. Then and still I think we don't have that awareness from where we can get. Even the hospitals are not giving that much of contacts, or what exactly is happening there, I'm not sure. If I would have not contacted sir, I would have not, till now it's like 7 years, I think. By the time when my dad was diagnosed, he was already 69 years old. So, but after that, he managed to do well, and we started understanding him, what he wants. And it took 1 year for us to get the electrolarynx. And then he started learning how to talk, and now he continuously he talks, no stop for that. And he's apart from that particular issue that his actual voice is not there, he's fine. Luckily, the cancer did not transfer to any other part of his body, and that is one of the reason they have suggested us to remove the whole larynx. And the doctor, after completing the whole radiotherapy and all, they were like, "Do you want to go for? Can you take one cycle of chemotherapy?" So they are like giving it as a suggestion. Then we decided as a family, no, we will not go. And it's been luckily touched where my dad is doing well. And only tips, what for the caregiver, as a caregiver, what we will give is, the first thing, at least in this particular cancer, they will not be able to communicate what pain they are going through. They must be going through a different level of pain that we cannot understand, and they cannot tell also. So only thing is, we have to be very patiently understanding their situation. If we are in that situation, what we would want. So like that, I have one small incident. I think after 1 month, immediately after the operation, I just want him to not sit at home. We want to go for a walk and all. He was well. He was coming walking, and suddenly he fell down. And that time he didn't have this electrolarynx, nothing. It was just a month after the surgery. He fell down like this, and he couldn't get up because they have removed some lymph nodes and all. He didn't have that much of physical fitness to get up by himself. So, and I was talking and I was just moving on. I didn't realize that he's not coming. At So what happens now at this kind of cancer? We forget that he is a patient. He randomly talk, and that is when I realized he fell down. He could not even move. Then nobody was there. I couldn't even lift him. Then his only thing, I thought something happened to him. I was the only one there, and when I saw him, like, I just went near him, and he's trying to tell from his eyes that he's all fine. You know, that is when I understand you and the patient should have that proper eye to eye contact, or what exactly happening to him. If at all he didn't blink or he didn't try to communicate with his eyes, I would have not known what I don't know what would have happened. And then we rushed to hospital. Again, in the hospital, they are not allowing, in the emergency, they are not allowing us to go inside, right? But we are supposed to go for this kind of patient. We are supposed to go because they cannot talk, and we are the one, as a caregiver, should explain the doctor what is happening. And I managed that he's not a nose breather, he's a neck breather, and all of this I have to explain them even before they start the medication. Then everything happened. So as a tips, what I would say is, if they become better, it is not that they completely fine at the starting. So we should be always there until they are in a proper completely cured, or completely they're well. We will not know when it is. So first thing, we should have that good rapport with our patient, with the patient that we are dealing with. and we have to understand what they are going through. They'll have different level of stress and depression going on. We should be there to just support them. Sometimes my mother always used to go into the kitchen and she'll be, "You want coffee? You want coffee?" She'll be shouting, but he'll be inside the bedroom. He cannot answer back. She will forget. Even after 7 years, she forgets and she keeps asking. So these kind of, and he gets irritated. So these kind of things we need to avoid, especially for this kind of thing. And maintaining his weight is very important. We have to make sure some good food that maintains his weight. And now, if you talk about emotional support, more than we giving, he's giving us back. So now it's like that. He's fully back. He's no more patient, and he's giving all kind of support that we were getting 7 years back. So I'm very grateful, I'm very thankful. And if SAR have not given that suggestion of the electrolarynx, I don't know where I would have gone. As a family, we need to be very thankful for you, sir. And really, what you people have gone through is very challenging, and we are very much inspired by all of you. And it's very motivating, sir. Thanks for this opportunity. Thank you so much.
Thank you, Radhika. I must admit, yes, I mean, earlier Manaji, she had talked and Rajvi has talked, but I must admit that, today you made my day. Today you made my day for the simple reason that, you know, you have very precisely, very profoundly mentioned that what is the pain, what is the pain when you are unable to speak naturally. That could be frustration, depression, anger, fear, helplessness, and whatnot. Yes, I agree with you. What you said that your mother is calling your father, like, would you like to have a coffee? But at times, she rather forgets that he has lost the voice which she has heard before. So I mean, commendable journey. And look, Radhika, I just played my role as a vocal cord cancer survivor, and whatever I can do anytime, feel free to reach out to me 24 by 7. And
Yes, sir.
one more thing, like Raji said, and Amanaji said, and you probably mentioned that life of any type of cancer survivor is absolutely incomplete without caregiver. And yes, I totally agree with you that eye contact, whispering, these, that, etc. These are the key elements. These are the key elements to be taken care of by caregivers sometimes, for various reasons. These are rather overlooked. But yes, they are very rightly mentioned everything about communication and taking care. And yes, I agree again that even in my case, when I'm going out, yes, I'm going out alone. These that traveling in India and abroad all alone. But at the same time, while moving, I am always on a ultimate care, because I know that I will not be able to speak without electrolytes. I will not be able to scream. I will not be able to shout, and this can cause kind of too many complications. So taking self care is, I mean, ultimate requirement. Friends, if anybody would like to ask questions to Radhika, please feel free to ask the question. And by the way, it was good that today Yona Govindji, our chairperson, she has joined. Actually, she had to attend one important meeting, so she texts me that night that she will not be able to make it to the session. But her now is commendable. She is always joining to all webinars. And practice with Shrenik, and our presence is quite commendable. Ritika, if there is any question from on YouTube or anybody would like to ask, let me know. And Deepak ji will invite you to share your experience and journey as a caregiver. The next time I will send you text. Uh, well, I believe there are Ritika,
No, sir, there is no questions.
great. So friends, thank you so very much for your faithful praises, Radhika, Aparnaji, Raji, everyone, and entire team of Indian Cancer Society. Thank you so very much for joining us today and making this webinar full of success. And Radhika, once again, thank you, Priya, thank you, Raji, and thank you so much, Aparnaji, for joining us. And I wish you all the very best to all participants. And we look forward to see you the week after the next Friday for something similar session about streaming life after cancer. Thank you.
Thank you, sir.
Thank you,
Bye.
Shrenik ji. Thank you for the insightful journeys of all the caregiver and the patients. It was really very inspiring today. Thank you so much.
Thank you, sir. Thank you. Bye.
Bye. Bye, Radhika. Bye. Bye, bye. Thank you.
Thank you.